If you're worried about changes in memory or other functioning in someone that's close to you or yourself, what should you do? Well, first thing is to get a bit more information. And there are some really useful websites. The NHS website, nhs.uk, has got a lot of information about dementia. And I'd also recommend Alzheimer's Society, which has got excellent information, and dementia.uk. And again, they've got really good quality information. At that point, when you've had a bit of a look and a bit of a think about what might be going on, the next thing is to get some professional help, and we're here to help you at the surgery. If you speak to the receptionist at the surgery, they'll be able to guide you to the most appropriate person to help deal with your problem. In some cases, this will be a GP, but in some practices, we have specialist mental health practitioners, physician associates, and advanced nurse practitioners, all of whom can do an initial dementia screening assessment, just the same as your GP would do. So what happens when you've had that initial assessment with a clinician? Well, when you see them, they will probably do a short memory test, and they'll take some additional information about other things that might be going on in your life to try and make sure that we're not missing other conditions. The next step, if dementia remains a concern, would be to organise some screening blood tests to rule out other conditions that can mimic dementia, and sometimes to organise a scan. We would also make sure that we're making a referral to the specialist clinics for a further assessment for dementia if no other obvious cause is found. How is a dementia diagnosis made? Well, we don't tend to make diagnosis of dementia in clinic at GP surgeries. This is done by specialist memory teams.
Hi, my name's Hayley. I'm the clinical nurse specialist for the memory assessment service in Robert.
Hi, I'm Claire. I'm the clinical nurse specialist in the TAF area for memory services.
So when we gather the information, when you come to your appointment, we, like what Claire mentioned previously, we gather all the information, as well as that we look at your ADLs as well. So is how you're functioning, skills in the house, what you were able to do and what you're finding more difficult to do. We do advise that a family member or a close friend comes to the appointment as well. So following that, as well as the blood test from the GP, the ACE3 that's completed with the clinical nurse specialist, a CT scan if needed, there would be enough evidence then to look at whether or not there is a likelihood that dementia could be diagnosed.
We're often asked what we can do as GP surgeries to support people living with dementia or those that are caring for them. And there are a lot of things that are really important here. Most practices offer an annual dementia check, and that's a time that we can think about doing a assessment of physical health for managing risk factors for dementia, including things like smoking, alcohol, diabetes, blood pressure, and cholesterol. But it's also a chance for us to have a think about the wider implications. So there we're thinking about social interaction, which can be really important, and we have access to excellent wellbeing support officers who can get us in touch with local groups or charities that can support people and their families with dementia too. There's also the importance of social services and any specific care support needs that might be needing to be met. And then thinking about carer support needs, that's really important too. And again, we have access to really good support services for our carers locally. And last but not least, we often need to think about the future when we're talking about dementia, and thinking about how people want the rest of their life to look, and having those conversations early and at a time when people can fully participate in those.